From the opinion pages of the Wall Street Journal, this is Potomac Watch.
A warning about government health care from Britain as China's population shrinks for the first time in decades. Welcome, I'm Kyle Peterson with the Wall Street Journal. We are joined today by my colleagues, columnist Joe Sternberg in London and Kim Strassel. Britain's National Health Service has been an immovable object in the politics of the United Kingdom for decades. But is that finally changing? The Journal has an editorial recently on the meltdown in the NHS, including the fact that ambulance drivers have gone on strike. And then once patients reach the emergency room, 35% of them now face waits above 4 hours between the decision that's made to admit them and their transfer to a bed for the appropriate treatment. Joe, can you give us a sense of what exactly is going on over there?
Yeah, Kyle. So the NHS winter crises have become something of an annual tradition over here over the years, and it's usually because the National Health Service struggles to deal with winter seasonal respiratory problems, especially flu. And, more recently to that, we're adding the effects of seasonal COVID now. The problem this time around is partly the COVID pandemic itself, because what happened during that period is that the NHS stopped providing various forms of routine care like hip replacement surgeries or cancer screens or treatments because it was so focused on COVID. And as a result of that, an enormous backlog, about 7.2 million patients deep, has developed for people waiting for those treatments, while now you have the regular seasonal problem. And that, coupled with labor relations problems, nurses, ambulance drivers are going on strike a few days here, a few days there, and the backlogs keep getting worse. And there is the sense that the system is kind of breaking down, that it can no longer cope with the number of patients who need the kind of care that those patients do need. So, that really is making this the worst winter season anyone can really remember for the NHS, and we're still only in the middle of January.
And these kinds of stories about the NHS are not new. One that has stuck in my mind, I guess, for years now is from 2019. It's from The Times. The headline is "Elderly Go Blind as NHS Ignores Eye Surgery Rationing Advice." The story says tens of thousands of elderly people are left struggling to see because of an NHS cost-cutting drive that relies on them dying before they can qualify for cataract surgery, senior doctors say. And so, Kim, this has been a long-standing problem, but it does seem like there is a breaking point here where even people who are supportive of the NHS ideals are saying that something has to change.
Yeah, and this is what you get when you have government healthcare. And I think that that's worth pointing out, just the way that NHS works for anybody who doesn't entirely understand its structure. I actually lived in England for a while, like Joe does now, and I didn't really have to use the system, but it is very much part of the entire fabric of the United Kingdom. And their point of pride is that they are not just a single payer system, which means that the government basically agrees to pay for everyone's health care via general revenue, but they're also a single provider, meaning the government is the employer of all NHS employees. So if you are a doctor there, you are a nurse there, if you are an ambulance driver, you work for the British government. And the combination of those two things, in my mind, is really what makes for all of these problems. Is that, Joe was just talking about, for instance, these workers going on strike. One of the reasons they are is because they want ever more money, even though there's not enough money to pay for all of the care that is necessary already. Politicians continue to throw money at it. But then you look at the dynamics there. You have a Labour Party that is always in favor of union demands. And so you get this kind of perverse system where you have a political party that is in favor of unions and are putting them ahead of patient care. So there's all kinds of ugly things that come up in a system like this. And that is what is remarkable to me, is that it is sort of hitting this breaking point, to the extent that some people are now saying, well, maybe we do need some changes. And it was remarkable that even the head of the Labour government said, this is not a shrine. We're going to have to look at this and maybe make some real reforms. It's long overdue. And I think part of the answer would be looking more to private options, which, interestingly, there is that in England. Even though it's single payer and single provider, you can still go to a private doctor if you want to, but you do have to pay for it out of pocket.
Joe, could you dilate a little bit more on how the NHS operates and the differences with some of the proposals in the United States? such as Medicare for All, which would be single payer, but would still be decentralized, and there would be different hospitals that operate according to their own rules. And I guess the argument from people who support the single payer model, Medicare for All advocates, they would say that we can't really draw any lessons from the NHS because it's an entirely different model, as Kim says, where the government is the one that is employing the doctors, employing the nurses, and running the system. How would you respond to that?
Well, I mean, I think it's definitely true from a structural level that kind of the way the NHS operates is different from the way someone like Bernie Sanders might initially talk about Medicare for All, because, as Kim pointed out, the NHS is also the provider of the bulk of healthcare in the UK, in addition to being the funder for it via tax money. But, I think it's important to remember that in some ways that can risk becoming a distinction without a difference, because ultimately the control always follows the money in healthcare as in anything in life. And so really you have ended up in the situation where once the decision was made that the government was going to be responsible for funding all of the healthcare provision in the country, the government inevitably is responsible for deciding how that is going to be done. So it's certainly true that the model that the UK has adopted is that healthcare workers essentially become government employees. It's notable that there have been periodic attempts to try to reform that system by decentralizing it, by creating what people refer to as an internal market, by sort of creating different regional hospital groups called trusts within the NHS that would try to operate on somewhat more efficient business-like principles. That has never succeeded because ultimately the politicians writing the checks are the ones who are accountable to voters for the outcome, and so they can't resist meddling in the way that the service operates. And I think that you would end up finding something very similar at risk of developing under a Medicare for All system, because again, the control would follow the money. And so the government inevitably becomes embroiled in these discussions about what the standard of care should be, how long people should have to wait for treatments, what sort of treatments are approved for the NHS, who those treatments are approved for. And, as soon as you've done that, what is the benefit of having a privately run healthcare system? Because the tax money is paying for it and the control is flowing from that, you have lost any of the competitive benefits that you had from a private system.
Another response, I think, would be to tell people to look at other systems that are not run like the NHS and still suffer some of these same problems. And Kim, I guess I would point to Canada. There are some numbers. This is a report from the Fraser Institute think tank. It's from 2021. And it looks at some data on, for example, the number of physicians per 1,000 people, and out of 28 countries that are in this ranking, Canada is 26th, far below comparable countries, Austria, Norway. There's a survey of people in 10 countries, and it says Canada is dead last, 10th out of 10 for wait times to see a specialist and receive elective surgery. And so I guess, Kim, I think that underlines the point that Joe is making, that if the government is the body that is footing the bills for this, inevitably there is going to be some kind of government cost control, government rules on who qualifies for what and how long they have to wait for it. That's the method of rationing the costs.
Right. Instead of the market sorting all of this out, you have one central player that has to ration in some form or another, and this is always what you get. So, and I would really stress that doesn't matter if you're single payer and single provider or simply single payer, as you note in the case of Canada. Look, Americans have been hearing stories for decades of Canadians who have extremely long wait times for what are routine procedures, things like getting a hip replacement, for instance, and the numbers of Canadians who would flow into the United States to get that work done here. You're seeing that right now in England. You mentioned some of those numbers, but as of November, there were 7.2 million Brits who had been referred for treatment and were still waiting for it. 2.9 million are waiting more than 18 weeks. The government feels that it's a giant success if they manage to see you within 4 months. For certain procedures, the British Prime Minister Sunak was recently in the House of Commons and said that if they would have victory if there were people who in certain procedures no longer had to wait for more than a year. So think about that. That is when you have a limited amount of money, the way that you ration treatment is to put people in lines, and that is the outcome of all of these systems. And so often, people will complain here about the higher cost of healthcare. But what you're seeing in these other countries, in both Britain and in Canada and other single payer and single provider models, is you get not only extremely high costs, but also very bad care.
Joe, how much do you think the taboo around suggesting changes, reforms to the NHS is breaking? I mean, who can forget the song and dance number about the NHS during the opening ceremonies of the recent London Olympics? And yet, as Kim mentions, the head of the Labour Party, Keir Starmer, had a recent op-ed in the Sunday Telegraph saying that the NHS is not a shrine. It needs unsentimental reform. Labor will make the hard choices that are needed to resuscitate it. He talks in this about as general practitioners retire and those contracts come back, he wants to phase in a new system that sees them fairly rewarded within the NHS. On the other side of the aisle, you have Prime Minister Rishi Sunak explaining, this was a headline in The Guardian, that he had used independent, non-NHS care in the past. Listen to this.
I am registered with an NHS GP. I have used independent healthcare in the past. I am registered with NHS GP. I have used independent healthcare in the past, and I'm also grateful to the Friarage Hospital for the fantastic care they've given my family over the years.
Joe, do you think we are getting to a point where the unthinkable reforms to the NHS, as they would have been characterized in recent years, past years, are no longer so unthinkable?
Well, it definitely does feel a little different this year around than it has been in previous years, because I think that there is a very, very slowly dawning realization that the scale of the problem is too great to be dealt with just by throwing billions more pounds at the problem, which was the traditional attempt to solve these things. And so that realization is taking a couple of forms. I mean, this political argument about private healthcare is really interesting because, well, Rishi Sunak, who is a member of the Conservative Party, is very delicate about trying to downplay his past use of the private healthcare system that exists in the UK for the wealthy. Some Labour Party politicians are suggesting that that might be part of the solution. Wes Streeting, who is the Labour politician who's their spokesman on healthcare issues, back in December had suggested that perhaps the NHS should start contracting out with some private hospitals or healthcare providers to treat NHS patients to start clearing some of the backlogs. And that felt like it was breaking a taboo to suggest that part of the solution to these problems might be the private market rather than more money for the NHS. And especially coming from the Labour Party, that creates a real Nixon in China moment on some of these issues. But the NHS is very deeply ingrained in the political culture and just in the general culture in the UK. People are very proud of the system, which presents itself as being very egalitarian, even though it does not provide equal healthcare results, especially because the wealthy can purchase private insurance to get around the NHS. And so I think that some of these lines about how we have to stop thinking about the NHS or a shrine are very tentative attempts to change that culture a little bit, but it is going to be a big task to get to the point where you can really have any sort of substantive reform.